if you are stressed, आपको कोई
Hmm.
परेशानी है, टेंशन है, आप दुखी हो, तो automatically your hormones will change, and that will give you acne.
Is there any difference between a male acne and a female acne? Because there are a lot of biological, differences between a male body and a female body.
So the underlying fire is hormone, but the fuel that you keep adding is your lifestyle. There is nothing like a great dermatologist and a good dermatologist. All dermatologists are the same. We all have the same degrees. But
Right.
there is definitely a dermatologist and a non-dermatologist.
Be it a female, be it a male. So, what steps should be followed to have a healthy skin in terms of your skin routine and everything?
You were right. You said be it a male or a female, because a lot of times men think they don't need skincare. It's not the macho thing to do skincare.
Protein powders that are taken to buff up. So, do they also somewhere trigger this acne issue?
Body acne is very common in a lot of bodybuilders. You are a great host and lots of podcasts, but you're really amazing.
Today we have with us Dr. Jaishree Sharad, who is one of the most celebrated cosmetic dermatologists of the country. She is highly regarded not only in India but abroad also. In this podcast, we have discussed about the basic skin problems, skincare routines, and all about acne and the treatments available. Personally, I have acne issues, and I would believe many of us are going through the same. We have discussed what causes acne, how can we prevent acne, what are the treatments available, and how our lifestyle is also adding to the issue. Through this podcast, we have tried to bring to you free consultation if at all possible. And I would personally suggest that you watch this podcast till the very end. I'm sure this is first of the many episodes that we'll be doing with Dr. J. Before I let you slip into this one, please subscribe to the iRonik Show channel and our newly launched the iRonik Show Clips channel, where you will find the main highlights of this long episode. Without any further ado, giving to you Dr. J on the iRonik Show to help you with your skin issues. Enjoy. Dr. Jaishree Sharad, ma'am, thank you so much for joining us on the iRonik Show. Uh, so, just to give a little bit of perspective, so not every celebrity, but most of the celebrities, they come to you, and for them, their looks really matter. So, will it be right to say that you are a lifesaver or a face saver for them?
I treat regular people also. It's not just
Right.
celebrities. So, uh, face saver for all my patients. Yes.
Okay. So what typically talking about celebrities? So do they also have this acne and pimple issues, or
Yeah.
is it just
Human
us
beings.
that have those?
They are human beings. In fact, they are more subject to stress and makeup and pollution and all of that. So they get more acne than us, I think.
Okay. And if there is a celebrity who has acne, maybe a larger one, and he has a recording next day, so is there a quick fix to it that can be
We
fixed? Maybe.
Yeah, we drain it sometimes. We give you an anti-inflammatory injection into it. Um, and yeah, so these are the two things. Sometimes we do cryotherapy, and so the whole thing subsides within 24 hours.
Okay. So, ma'am, for today's episode, we'll really keep it, basic. We'll start off with the basic of skin, skin issues, and focusing on mostly on acne and pimple. But before we go down that road, in today's social media world, you go to Instagram, you go to YouTube, you'll find so many influencers, so many, experts giving out their own opinion on skincare, on, makeup rules, the cleansing part, the 3 step or the 10 step rule. I'm not too sure of that, so giving out so much gyan out there. So how does one know what exactly are they looking for, and how to find out a good dermatologist? Let me put it this way: how do we distinguish between a good and a great dermatologist, and find out what is the right fix for us?
So there is nothing like a great dermatologist and a good dermatologist. All dermatologists are the same. We all have the same degrees, but
Right.
there is definitely a dermatologist and a non-dermatologist, right? Now, a dermatologist is one who has completed MBBS and then done post graduation,
Hmm.
either MD or DDV or DVD or DNB. These are the different degrees
Right.
in dermatology. So, which is usually a 3-year course. Okay. So, and after that also, like I have done my fellowship in aesthetics, even after
Right.
completing
Yeah.
my post graduation in dermatology. So, you do fellowships, you can either do them abroad or you can do them in India. Now we have good fellowships in India. So it takes a lot of hard work, and then we constantly upgrade ourselves by going for conferences, workshops, seminars, nationally and internationally every year, right? So that is a dermatologist, a proper, qualified, trained professional.
Yeah.
Now, you spoke of Instagram or social media. There are a lot of people who are not even doctors, right?
Yes.
But they are talking about skincare. They're talking about, oh, you should be using this in the morning, that at night, retinol is good for you, that is good for you, that is not good for you. With due respect to them, yes, you can read the internet, you can read books, you can get knowledge, but that doesn't make them like a qualified professional to be able to treat a skin condition. They will
Right.
be able to suggest कि भाई ये sunscreen लगा लो or
Hmm.
use this face wash or whatever, but they do not have the ability or the expertise to examine your skin and recommend things to you. Today there are people who have millions of followers, millions,
Yeah.
all right,
Absolutely.
they're talking about skin every day, morning, night, but where is the expertise? Right?
Yeah.
So, yes, you can gain knowledge. They're doing a very good thing because they are creating awareness. नहीं तो वरना इसके पहले तो अवेयरनेस भी नहीं था, लोगों को ये भी
हाँ.
नहीं पता था कि नहीं सनस्क्रीन शुड बी यूज्ड एवरी सिंगल डे इवन indoors. So they are doing a good job. But if you really want to have the right skincare, आपको you should go to a dermatologist at least once and get your skin examined. So look at the degree and then identify, because these days they may just be any other doctor but they're not dermatologists,
Hmm.
right? Same thing
Absolutely.
happens for injections when we're discussing fillers, botox. Not everybody is trained. There is a lot of anatomy that goes that one has to learn. It's not just injecting anywhere. I have known or heard of people who have looked at YouTube videos and started injecting fillers and Botox and
Wow.
then mess up the face, and then there will be side effects. So you need to understand that you have to go to somebody who is an MBBS, a dermatologist, or a plastic surgeon, and an MBBS
Hmm.
with an added qualification and special training in injecting fillers and Botox. ये तो आजकल तो पार्लर में भी हो रहा है.
Hmm.
It's very scary. And then you see a lot of side effects. So then you blame the Botox and the fillers.
Right.
So that is how you have to qualify, you have to differentiate. And if you see that the person has written that the person is a doctor, that is not enough. Because वो कुछ भी doctor हो सकता है. You can be
Hmm.
a
Hmm.
Unani medicine doctor with due respect to them. They are not dermatologists. So you have to look at the degree, MBBS with MD, DVD, DDV, all of that.
Okay. So let's stick to the really common problems that someone like, because I am also going through a lot of acne and pimple issues, right? Typically during the teenage phase, right, when your body is changing, be it male in be it in female, these acnes tend to acnes and pimples really disturb you and they don't tend to go away. So, but at this point of time, at this age, why are people having so many skin issues? What exactly is the reason for having these skin issues, and what other than acne and pimple, what are the common skin issues that people are having? What they typically come to you for?
See, it's not that now people are having more skin issues. People have
Yeah.
always had skin issues, but people were not aware. Number one. Number two, they did not give skin so much importance. They did not give their looks so much importance.
Right.
It was a very chalta hai attitude. All right. So yes, when you talk of skin, it's not just acne. There can be psoriasis, there can be eczemas, there can be allergic reactions, there can be urticaria. Hyperpigmentation is a very big issue.
Hmm.
Pigmentation on the face, on the body. Then there are more severe diseases like pemphigus and autoimmune diseases. So there are a lot of skin fungal infections, bacterial infections. All these
Right.
skin issues are there. Now, yes, you may be right that acne may be on the rise these days, and
Hmm.
that is primarily because of the lifestyle. Acne
Okay.
happens in adults due to hormonal changes, and when you're talking of adult acne, it happens due to hormonal changes which are related to lifestyle. So if you're not eating right, if you have late nights, you're not sleeping
Hmm.
right, you're having late night parties, you're having a lot of alcohol, you're smoking, you're taking weed or you're vaping or Juul or whatever it is, the lifestyle is unhealthy. You have a lot of sugar in your diet, and of course stress, major factor,
Okay.
and finally pollution, which is not in our hands. So all of these will alter your hormones and then send signals to the sebaceous glands, which are the oil glands, which will produce more sebum. Once they produce more sebum, the normal bacteria called Cutibacterium acne, which lie in those oil glands, will multiply because suddenly they've got so much food
Hmm.
because there's excess sebum production. So they will multiply, and then from blackheads and whiteheads, you develop pimples. So it's a full cascade that happens. So I would probably not be wrong in saying that acne is certainly a lifestyle disorder in adults.
So there is a friend of mine who also stayed in Delhi, right? And I think it was, I think 5 6 years back, he moved to his hometown. Has his own business and everything. So while he was in Delhi, he had these skin issues, acne problems, and a lot of other skin issues. But since from the time that he has moved to, it's a smaller, relative to compared to Delhi, it's a smaller town, a hometown. So since the time he has moved out there, obviously because of there is no pollution, the food that he is eating is completely homemade food and clean food. I see a lot. I mean, his face has completely changed in terms of it glows. It glows, and there is no. I mean, when I compare my skin to him, I'm really jealous. Yeah, how have you achieved this? He said, "कि मैंने कुछ नहीं किया यार. I don't use anything.
Yeah,
It's just home food." Yes, obviously he does yoga. He's into fitness. He has changed his lifestyle a lot, and it shows in his face. So, is it?
true.
I mean, when you talk about your skin issues, is it also related to how you are feeling inside? I mean, how your health is, how your gut is.
So your skin on the surface is related to your lifestyle, just as you said, and I also just
Yeah.
told when you talked about your friend that the lifestyle has changed. He said he's done nothing, but the skin has improved, right? But how you feel on the inside, is that going to make a difference to your tone, texture,
Hmm.
all of that? No, that will not happen. But if you are stressed on the inside, okay, if you are stressed, आपको कोई
Hmm.
परेशानी है, टेंशन है, आप दुखी हो, तो ऑटोमेटिकली योर हॉर्मोन्स विल चेंज, and that will give you acne. There is a possibility that that can give you acne, that can give you hair fall, that can give you, whatever existing
Hmm.
eczemas can increase. So there is a science behind all of that. There's a logic behind
Right.
it.
Right.
That why, if you are unhappy or if you are tense or if you're stressed, why do you get acne or why do your eczemas or psoriasis increase? Because of the hormonal changes.
On a very biological level, what causes acne? I mean, obviously there are glands, sweat glands and everything, under your skin. So what exactly is a trigger point of an acne?
So now in your teens, when you are either attaining puberty, the hormones are changing.
Hmm.
Okay. And then the hormones are trying to find something called the hypothalamus pituitary axis. They're trying to find a balance. And during that period, in people who have a genetic predisposition, there will be a lot of oil secretion because of the hormones going up and down.
Hmm.
And when there is a lot of oil secretion, the normal process of excretion of that oil in the skin is through the pores. The
Right.
pores that we say, a lot of people say, my pores
Hmm.
are open, my pores are open. Actually, your pores are supposed to be open. We have about 20,000 pores on our face, and they are supposed to be open because only if they are open will this oil or sebum be excreted out, right? We don't see it.
Right.
If it is done in excess, there's a lot of secretion, you feel that the skin is oily. Okay?
Yes.
Now, the pipe or the opening is small, but there is overproduction. So what will happen?
Hmm.
There will be clogging. So that clogging, that oil will collect, and become like a thick white. When you have ghee which solidifies, becomes
Yeah.
thick white, right? So this same way, these lipids and oil will clog and collect because there's over secretion. The body is not able to throw it out through
Hmm.
the pore. So that collects and solidifies. And that becomes a whitehead.
Okay.
Now, when this whitehead gets exposed to light, it becomes a blackhead
Okay.
because it gets oxidized. All right, it's not dirt. It's
Understood.
oxidization of the whitehead, of the sebum in the whitehead, that turns it into a blackhead. Now, the third thing, as I said, that there are normal bacteria which are present in the glands. Okay. Now, suddenly, because there is an excess of that sebum, these bacteria, Cutibacterium acne, they're called, they have a feast. So when they have a feast, they are multiplying in number,
Yeah.
and so there is a lot of inflammation. And so when there is a lot of inflammation, these blackheads and whiteheads will turn into pus-filled pimples because the bacteria have increased in number.
Hmm.
So you will have pus-filled pimples. When 2 3 oil glands get together, because इतना सारा secretion हो गया है that
Yeah.
if there is one here, but both have swollen because there's a lot of oil secretion, then they become one, and then you get that big cyst, the large cyst. So
Right.
that is the whole thing about how acne are formed. Now, what are the triggering factors apart from hormonal imbalances? The basic thing is always hormonal imbalance, whether it's a teenager or an adult or an old person, whoever. It's always the underlying factor is always a hormonal imbalance, but there are aggravating factors. So the underlying fire is hormone,
Hmm. Hmm.
but the fuel that you keep adding is your lifestyle, which means the diet, sugar, dairy, jaggery, maida, potatoes, anything with high glycemic index, pizzas, burgers, all of these will increase a hormone called IGF-1, which will send signals to the oil glands again to produce more oil. So that is a fuel. It's an add-on aggravating factor. Then, so that is food. Second is sleep. So if you're not sleeping adequately and you're not sleeping on time, your
Hmm.
body loses its circadian rhythm, you know. And then again, the same thing happens, signals to the brain and then to the oil glands. Third is stress. If you're stressing a lot, your cortisol hormone will increase. If that increases, again, the same cycle
Okay.
of increasing the hormones which produce more oil. Fourth is pollution. Pollution also disrupts the hormones. Fifth is lack of exercise. And the last important thing is things that people apply on the face. So if you apply a lot of oil on your scalp and sleep overnight,
Hmm.
and that oil trickles on your face, the oil can clog the pores. The opening that I'm talking about, which is, a normal process of having your sebum thrown out of the
Hmm.
skin, of the body rather, that if you block with oil, with any product that you apply on the skin, which is oil based or cream based, then there is collection inside again, and then
Yeah.
the same process of over oil, oiliness over, there's a lot of sebum there, the bacteria will multiply, the same process. So again, you should, if you have oily skin, you have to use the right kind of products. If you have acne prone skin, you have to make sure your products do not have oil and heavy creams in them, because that will also clog pores and give you more acne. So these are all the
Yeah.
various aggravating factors. And one thing I forgot, is some medicines like steroids. So sometimes steroids are given as a medicine for, lung
Uh-huh.
infections, lung asthma, and autoimmune disorders. And sometimes people take anabolic steroids,
Right.
right? Both will increase acne.
So when you're talking about steroids, I mean, one is the medical part of it when your doctor or someone is treating something for you, they tend to give steroids to heal you quickly. Now the other part is, there are a lot of people who are going to gym and taking steroids to build up their muscles and body.
Yeah.
And apart from steroids, there is also, they are taking a lot of these proteins and everything. So apart from steroids, are these protein powders that are taken to buff up, so do they also somewhere trigger this acne issue?
Yeah. So, if you take whey protein and you have an acne prone skin or a
Hmm.
genetic history, uh, whey has casein, which is milk. And I just said milk should be avoided.
Yeah.
Milk also increases the IGF-1 level. Secondly, milk may have a lot of hormones. Thirdly, sometimes when they're feeding the cows, they're also adding a lot of hormones and antibiotics, and that itself, so the milk comes out as full of these hormones. So, which is why we say no to milk. And milk has casein. Whey
Yes.
protein also has casein. And so, if you want to have proteins, stick to some plant based protein if you have a genetic predisposition for acne. So, now why am I clarifying here? Because then somebody will say, oh, but I
Hmm.
have whey every day. मुझे तो कुछ pimples नहीं होते. मुझे नहीं होता
Hmm.
कुछ.
Hmm.
आपको नहीं होता because you don't have a genetic predisposition. You don't have a hormonal imbalance. You don't have probably an acne prone skin. Everybody who has sugar does not get diabetes.
Right.
You have to have a genetic predisposition or something drastically wrong in your hormones to get diabetes. The same way, if you have all these triggering factors, you have a history, you have a background, and you take whey protein, it will definitely give you acne. Body acne is very common in a lot of bodybuilders, if you see. That's because of the high amount of casein in their whey protein and, of course, the anabolic steroids.
So we just talked about we just discussed the biological reasons or the lifestyle reasons for acne. So is there any difference between a male acne and a female acne? Because there are a lot of biological differences between a male body and a female body.
The hormones work just the same. There is no
Okay.
difference. All right. In fact, males have higher levels of testosterone. So males
Yeah.
will get more acne if you look at that point.
Hmm.
But females get polycystic ovarian disease. And because of that, they get acne. So primarily, it's almost the same. You know, uh, the hormones work the same. If we talk of comedonal acne, those blackheads and whiteheads, that may be more in females who are using a lot of skincare products that even guys are using these days, layering
Hmm.
your skin with too many things, not allowing your skin to breathe, clogging your pores because you're layering your skin, or using a lot of thick heavy makeup every day, and that is clogging your pores. So that way you may say that okay, females get more acne than
Hmm.
males,
Hmm.
but biologically there is no difference. Biologically, in fact, males scientifically should get more acne than females because they have higher levels of testosterone.
Okay. So now when an acne occurs, because there are a lot of people like me who get irritated, we try to pop it up, and uh, even when you go to a salon, right, they will try to cut it out, and that leaves a really bad scar. So is that a completely separate treatment, or is it as part of the same medication or the antibiotics that give to your acne issue that can also take care of the scars?
No. So, first of all, it's very important not to touch the pimple, not to try and squeeze it and pop it on your own.
Mm-hmm.
Two things happen when you try to pop it on your own. One, we all have microbes in our, in our fingers and especially the nails, right? We all have. We probably have millions of them, right?
Right.
Now, we are trying to pop something and we're introducing those microorganisms into the skin. So we're increasing chances of infection. Secondly, we are damaging the skin to a deeper level, which is why
Okay.
you end up with a scar. So it's always better to just leave it as it is and let the medicines do their job, whatever medicine your dermatologist has given you, whatever creams,
Mm-hmm.
whatever tablets. Have patience and do not pop the pimples. Number one. Now, talking about salons, if it is a very qualified, run by somebody qualified and they're very, very thorough, and they know how to remove that pimple, then you may go to them. Otherwise, go to a skin clinic, because then our technique and is very unique. There's a special
Mm-hmm.
technique to remove the zit, and our instruments are sterilized. We have a full autoclave chamber where we put all the instruments, and we properly sterilize them. And once we use it on one person, we do not use it on another. We don't just wash it and use it on somebody else, or we
Right.
don't just boil it in water and use it on somebody else. They're properly sterilized. And so and then you are gloved and you're doing the treatment. So that way you are also not damaging the skin to a deeper level and not causing any infection. Now, coming to your question, that is the treatment different from the regular acne treatment? Of course, the treatment is different, because you are talking of acne there, where the pathology is different,
Hmm.
where we are trying to, you know, uh, combat the hormonal imbalance or the bacterial overload. And here we are not combating the bacterial overload or the microorganisms. Here we are only dealing with hyperpigmentation, dark spots, blemishes. So the treatment is different. The kind of creams that we give will be different. We may do chemical peels. Sometimes, if they're very stubborn or resistant, or somebody needs very quick results, we may do Q
Hmm.
switch Nd:YAG laser. We may do peels. We may do Pico laser. So there are lots of treatments that we do, apart from certain skin pigment lightening creams, which we give initially for those dark spots to reduce. That will not work on the acne. They're two separate entities.
Okay. So you just talked about the medicine given by the dermatologist. So do you also prescribe antibiotics? I mean, because there are a lot of cases. Because I have also heard my friends taking antibiotics, and that have worked like magic for their acne. So.
So there are, don't forget, acne is a pathological disease. It's a
Hmm,
problem,
hmm,
right?
right.
I mean, even if people say, oh, it's normal, we have discussed the whole pathology right now, right? So,
Yes.
most definitely, if you just have blackheads and whiteheads, antibiotics will not work. But if you have
Okay.
pimples, and as I have said right in the beginning, that is because of the bacterial overload, how will the bacteria die? You have to give an antibiotic to kill the bacteria,
Hmm, hmm,
right? So there are specific antibiotics which are given. Um, of course, we give cefadroxil sometimes. Sometimes we give azithromycin, but most commonly we prescribe the tetracycline group of antibiotics, right? So minocycline, limicycline, doxycycline. These are the antibiotics which are prescribed for a short period of time to reduce that bacterial overload, to reduce all those pus-filled pimples.
hmm.
And these antibiotics, not the not the azithromycin or the cefadroxil, the other ones, the tetracycline group,
Hmm.
usually will not be given for 5 days, 7 days. They will be given for at least 3 to 4 weeks.
Okay.
That's how they are designed. That's how they function. And so, that fear that, oh my God, this is an antibiotic and the doctor's prescribed it
Hmm,
for a
hmm.
month, should not be there, because that's how they are programmed to be killing that particular bacteria, and they do no harm. Now, there is something called antibiotic resistance, which is very common in our country. And why does that happen? Because patients or people self medicate.
You're right.
So when you don't know what should be taken, and your friend has improved because he has taken doxycycline, and you are also taking it, but you actually need something else
Hmm,
because your
hmm.
type of acne is different, then you will develop resistance. So please do not self medicate, is my message to everybody.
So quickly on antibiotics. So if I again go back to the biologics of an acne, so where you mentioned that your glands secrete a lot of oil, right? So when you're talking about antibiotics, so what I could understand that they are trying to reduce the size of this, the quantity of the secretion or the size of this pores.
We are discussing, if there is oil
Mm-hmm.
secretion, antibiotics will not work. If,
Okay,
if
okay,
it is oil, as I said, that when you have blackheads, whiteheads, antibiotics will not work. Then you will have to give isotretinoin, or if there's a hormonal imbalance, you will have to give hormones. Antibiotics will work when there are pus filled pimples.
okay, okay. I'm clear, absolutely clear now.
So
Got
when
it.
that oil, is feeding the bacteria. Remember,
Hmm.
I said the
Hmm.
bacteria are feasting
Yeah.
on that excess oil. The bacterial load will increase. अगर आपके ऑयल ग्लैंड में 10 बैक्टीरिया थे, वो 10 मल्टीप्लाई होके 1000 हो जाएंगे,
Hmm.
तो उसमें पस हो जाएगा. And when you have pus in that, you will have to take an antibiotic. So an antibiotic will only work in those cases. It will not
Okay.
work in all the kinds of pimples or acne. Acne are what? Acne are blackheads, whiteheads, papules, pimples, those pus-filled pimples, cysts, and nodules. Nodules are those which occur inside, hard lumps inside.
Hmm. Hmm. Hmm.
All of these are acne in the medical term.
Okay.
Got
So
it? Is it clear?
absolutely, absolutely clear now. Absolutely clear. So before talking about the antibiotics and everything, you mentioned a big role of physical exercise, obviously, and the diet, right? So I would just like to expand a bit more on the diet part of it. What food should be taken so that you don't have these issues? What kind of categories of food should be avoided? One is refined, you already mentioned that, and sugar should be avoided. So if I can request you to just expand a bit on the dietary part of it.
When it comes to acne, what should you include is not important.
Okay.
Is not important.
Okay.
What should you not include is important,
Okay.
right? So, what should you not include? We have discussed the whole thing just
Mm-hmm.
some time. That
Yeah.
no sugar, no jaggery, no honey, no dates, no milk, no maida, no food with high glycemic index like fried potatoes and all of that. That is
Okay.
important. Now, what should you include? Everything that's healthy. Green leaves, antioxidants, so brightly colored, vegetables, a lot of nuts. I mean, it really doesn't matter. As long as you're having healthy food, it doesn't matter. I
So.
have had this and so I'm not getting pimples, it doesn't work.
Mm-hmm.
I'm having a lot of nuts or I'm having a lot of seeds, so I'm not getting, or I'm having neem leaves or I'm having karela and so I will not get pimples. No, I'm sorry, that doesn't happen.
So
Okay.
you actually broke two of my notions that I had, since my childhood. कि नीम ले लो, करेला ले लो, your skin will improve, you will not have acne. And
Yeah.
second one was you mentioned that कि you should not put oil, overnight, and because oil tends to secrete, I mean tends to drip down to your face and may block the pores. So even if you see in today, many women they prefer to have put in oil and leave it overnight, and then the next morning they will just
So we
wash it away.
always say apply oil because oil is a very good conditioner,
Yeah.
but leave it on for 4 hours and then wash it,
Okay.
rinse it.
Okay.
Don't sleep with your oil on the scalp because there is a possibility that you may get acne, especially along the hairline or on the
Mm-hmm.
shoulders, on the back. So that's something that one must remember. Okay. Now, having said that, don't say that Dr. Jaishree said don't have healthy food. I'm saying please have healthy food because unhealthy food will give you
Right.
acne. So that's why I said the don'ts are very important. You
Mm-hmm.
should not have unhealthy food because if you have unhealthy food, automatically your acne will increase. But if you have healthy food and have all the other triggers like hormonal imbalances, because I do have patients who come and say, "Oh, we eat so healthy and still we're getting acne,"
Mm.
right? Because the cause is not the food. The cause is your hormones. The
Right.
cause is maybe something that you're applying on your face which is not agreeing with you. The cause is your stress levels. But with that, with that cause, if you add,
Mm.
you know, or mirchi dalo, usme or tel dalo, so you add a little more something aggravating like sugar, then jo existing here that will increase.
Right.
You got the logic now?
Yes, yes. So when you talk about milk, is it the casein you mentioned? And can people have lactose-free milk, or does that also have casein?
It's all milk,
All
not
milk.
just casein. Casein we discussed because we were discussing whey protein.
Mm-hmm.
But any milk, if you have a tendency for acne, or if you have PCOS, or if you have
Mm.
insulin resistance, or if you you have a genetic predisposition for acne, then any milk can cause cannot not cause but aggravate the acne.
Okay.
It could be lactose free, whatever. uh, Skimmed milk, has the maximum amount of hormones. So that's the most harmful.
Okay. Wow. Now getting into the basics of skincare. I mean, so you. I mean, I think 4 or 5 years back, I didn't have that habit of using sunscreen. Now I don't step out of the home till the time I put on sunscreen.
I'm so
So
proud of you.
yes, so I did not realize I got married 5 years back, and since then I have not stepped out of the home without applying sunscreen.
Then I'm
Uh,
proud of your wife.
exactly, exactly. So I just want to talk about the basics of skincare, be it a female, be it a male, right? So what steps should be followed to have a healthy skin in terms of your skin routine and everything?
So, first of all, you were right. You said be it a male or a female, because a lot of times men think they don't need skincare
Right.
because it's not like, it's not the macho thing to do
Yeah.
skincare. But skin is the largest organ of your body. And whatever gender you are, you need to take care of your skin, because the skin is protecting your internal organs,
Hmm.
protecting you from environmental toxins. It's a temperature regulator, it's a hormone regulator, it has a lot of functions. So please take care of your skin, whatever it is. Now, does male skin and female skin care differ? Uh, if I may put it, actually, it doesn't so much. Yes, male skin is thicker, it has more oil glands, men will produce more oil, that is there. But the difference happens if the male doesn't want to do too many layers,
Hmm.
right? Men generally, when they come to my clinic, I will give them a face wash in the morning and one cream, like a sunscreen, which has moisturizing ingredients, so that they don't have to apply too many things. Because generally, men don't like to apply anything. So give them one product in the morning. So I usually give them a sunscreen with moisturizer in it. Bus. So that
Okay.
is one thing in the morning. So what should you do in the morning, whether you're a male or a female? You cleanse your face, then you apply a moisturizer depending on your skin type. If you have oily skin, use a gel based moisturizer. If you have dry skin, use a cream based moisturizer. So, depending on your skin type, you choose a moisturizer. And then, depending on your skin type, you use a sunscreen. So, this is the three-step routine that one must follow, come what may. Now,
Okay.
out of this, I said I simplify it for men, where I prescribe usually a combination of a moisturizer with a sunscreen. So you're doing both of them. Then comes the many layers that people do. So after your face wash, if you have very oily skin, you may tone, or if you're exposed to a lot of pollution, you may use a
Hmm.
toner. But toner is not a compulsion. I have never used a toner in my life. I'm 50 years old, right? I've never used. So, has that damaged my skin? No, I don't think so, right? But those who want to use it, you are free to use a toner. Make sure you use an alcohol free toner. Then comes the serum. Okay. So, a lot of people now, courtesy social media, are aware of all the serums. So if somebody has hyperpigmentation, then as a dermatologist, I will prescribe a vitamin C serum. Uh, if the person doesn't have acne, or if the person has acne, I'll probably prescribe a niacinamide serum, or probably no serums at all if there is active
Hmm.
acne. So depending on the different conditions that the people have, if they have dry skin, maybe hyaluronic acid serum. If they have dry and hyperpigmented skin, then niacinamide serum. If they have very pigmented but no acne, then vitamin C. If they want antioxidants, anti-aging, then again vitamin C. So face wash, tone, plus minus, then serum. Again, serum is plus minus. If you have
Okay.
conditions, or
Hmm.
if you
Hmm.
want the skin to be better, you add the serum. Then you do the moisturizer, and then you do the sunscreen,
Okay.
right? So that is the elaborate layering, which is not a compulsion. It's only
So
if you want to make it better. It's like adding all the flavors to your basic boiled chicken, or
hmm.
just
Hmm.
boiled paneer. You can just, boil the paneer and add salt and have it, or you add all the flavors to make it better. So if you want to make the skin better, then you add the
Hmm.
serum.
Hmm.
But if you just
Okay.
want good skin, then just moisturizing and sunscreen is enough. That is your day routine. At bedtime, however tired you are, if you have makeup on your face, you have to
Hmm.
remove that. And then you will cleanse again. And then you can just apply a moisturizer and go to sleep. That's as simple as that. Don't forget to moisturize your entire body, not just the face.
Hmm.
Now, if you want to go a little elaborate, then you wash your face, you remove makeup, then you wash your face, apply an under eye serum, then apply a full face serum. Again, depending on your requirement, you could use an AHA, BHA, retinol, niacinamide, vitamin C. There are so many. You'll have to consult with a dermatologist for that.
Yeah.
So, under eye serum, full face serum, then you use a targeted cream. What is a targeted cream? I have acne. So, okay, I will use an anti acne. Oh, I have hyperpigmentation. I have blotchy, uneven skin. I will use a cream which is meant for pigmentation. I have a lot of fine lines. I have wrinkles. I will use a cream for anti aging. Or I have nothing but I just want an anti aging cream. I will use an anti. I will use a skin brightening cream. So after the serum, you use that cream. That is called a targeted cream. And then finally, you use a moisturizer.
Okay.
So that is your elaborate night routine. If you want a simple night routine,
Hmm.
wash your face, apply moisturizer, go to bed.
But you have to wash your face at night before going to bed and
You
apply a
must wash
moisturizer.
your face
That's
and
a
you
must.
must moisturize. These two
Okay.
are a must. Just like in the morning, you have to wash, you have to put a sunscreen.
Hmm. So I have two questions out here. One is regarding the cleanser or the face wash, and second is regarding the sunscreen. So we have so many SPF 50, SPF 30, and all that. So, so we live in a tropical country. So what is the correct SPF that we should use?
See, SPF is the full form for sun protection factor. Sun protection factor takes care of ultraviolet B rays. Okay, so ultraviolet B will protect you from skin cancer and skin sunburns.
Hmm.
Okay, so ultraviolet B will protect you from sunburns and skin cancer. What about all the other things? Pigmentation, fine lines, wrinkles, early aging, dilatation, your pores become dilated with age. That,
Right.
allergies, suntan, all of that happens with UVA rays, blue light, visible light. So you need protection from ultra Indians. We in
Yeah.
our climate, the way we are placed, geographically, we need protection from UVA, which means we need something which has a PA value, protection from UVA, that is PA value. So we must look at a PA, a sunscreen which has a PA of 3 plus or 4 plus.
Okay.
Okay, and the SPF could be 30. An SPF of 30 will give you 93% protection from sunlight. An SPF of 50 will give you 95% protection from sunlight. So just 2% more.
Okay.
So if you are not going to be outdoors throughout the day, then an SPF of 30 is enough. But if you think you're going to be outdoors, and you can't reapply the sunscreen every 2 hours because you are supposed to use a sunscreen every 2 hours, but for whatever reason you can't reapply, then in those cases you might as well use an SPF 50, because it will give you that little
Right.
2% extra protection, that much longer, maybe an hour longer.
Absolutely.
So that is the difference between the SPF 30 and 50. An SPF of 100 will give you about 97% protection. So the difference between a 30 and a 100 is very
Just
less.
4%.
Yeah.
Okay.
So that is why what you need to see is the PA value. PA3, PA4, PA5. PA5 best.
Okay.
But if you and I, like, I don't know what your profession is, but I am indoors all the time.
Hmm.
So for me, an SPF of 30 with a PA of 3 plus is enough. Still use a sunscreen indoors.
Yes. So my question was regarding that only. So there is a misconception or myth, you may misconception, I would rather say, that we don't need to apply sunscreen if you are indoors or if it's cloudy outside, or probably if you are during the winters. So what would you say for that? What would be your take on that?
So right now, I'm just going to turn this, and you see how much
Yeah.
of daylight,
Mm-hmm.
right? And it's raining.
Yeah.
All right. So there is 70% of UVA, okay, which is penetrating this glass window of mine.
Right.
And I am directly exposed to 70% UVA.
Hmm.
All right. The same thing happens when it's cloudy. 70% of UVA will penetrate glass and will penetrate clouds. So whether you're sitting indoors or whether it is a cloudy day, you're still getting 70% UVA. So you will still have, allergies, rashes, sun allergies, pigmentation, early aging, collagen degradation, increase of melanin, all that will still happen. Which is why on a cloudy day, you still need a sunscreen. And
Right.
if you are indoors and you are exposed to lights like this, okay, or you have balconies and you're sitting in your balcony
Mm-hmm.
for long, or you're going to the terrace for long, you are still getting exposed. We don't realize. Housewives are going time and again outside to the balcony, hanging
Yeah.
clothes, getting clothes inside, or somebody's having a cup of tea in the balcony. So there is, or somebody has just light like my windows, you know. So you are still getting exposed. Now, the other thing is when you are indoors, and suppose you say, no, my room is very dark, I don't have any daylight coming in.
Mm-hmm.
Are you exposed to the blue light from your laptop for over 4 hours? If you are, then that blue light, and if you are not, if you're sitting at, say, a distance over 2 feet, that's fine. But who sits 2 feet, away from a laptop,
Right.
right? So, and if you are going to sit and work, say for anything up to 4 and over 4 hours, 4 to above 4, blue light is also going to damage your skin in a very similar way that ultraviolet A damages your skin. And that is why you need, if you have only indoor work, then you need a
Mm-hmm.
sunscreen which protects you from UVA, UVB, of course, but also from blue light, which means you have to use a tinted sunscreen, right?
Okay. So
So
whether
a
you're
tinted
inside or outside,
you still have to use a
still have
sunscreen.
to use
And if
sunscreen.
you are using a laptop for long hours, you will use a tinted sunscreen because tinted sunscreens have iron oxide and that will protect you from blue light.
So few months back, I had a really bad experience because my acne was not healing. So I went to a dermat and she suggested me benzoyl peroxide, ointment of benzoyl peroxide, and it helped me. But it helped me for a few days, but then again the acne came back. So there are medicine, and there probably because of my lifestyle at that point of time also that it did not heal. So there are medicines like Accutone, if I'm not wrong,
Accutane.
isotretinoin,
Yeah.
isotretinoin. So what exactly does this things do? I mean, are these a quick fix for acne?
No, no, no. This is a proper, well researched, one of the best medicines that is available for acne. It's FDA approved. It is a large dose of vitamin A. It is a derivative of vitamin A, nothing else. It's not a
Okay.
hormone, it's not a steroid, it's not an antibiotic. It is just a derivative of vitamin A. All right. But when you take large doses of
Mm-hmm.
vitamin A, and if you are pregnant, then even just vitamin A, if you're pregnant, then there is a malformation in the way the baby develops,
Mm-hmm.
embryo develops, which is why we say that it is unsafe during pregnancy, right? The other thing is when you take a large dose of Accutane, it causes a lot of dryness. Okay. The actual dose of Accutane is zero point 0.5 to 1 milligram per kilo body weight.
Okay.
Back in the day, we used to, the FDA had said 1 milligram. Then in India, we don't give so much. Now, suppose, I'm 50 kilos. That means I will need 50 milligrams of Accutane per day, isotretinoin per day. Now, that will cause a lot of dryness. So, we usually give 10 to 20 milligrams. In slightly heavier people, we may give 30 or 40 milligrams and not more than that. So if somebody weighs 100 kilos, I will not give
Hmm.
100 milligrams of isotretinoin. I will still give maybe 30 milligrams of isotretinoin. If somebody weighs 50 kilos, I will give 10 milligrams of isotretinoin. So it is weight dependent. Because larger doses, which are actually recommended, cause
Hmm.
a lot of dryness. So there can be dryness on the face, there can be chapped lips, sometimes there could be dryness in the eyes. So there's a lot of dryness. But having said that, we give low doses, right?
Hmm.
So the,
Okay.
the other thing is that when you take large doses of isotretinoin for a longer period of time, continuously, without getting going to a dermatologist or
Hmm.
monitoring it. Okay. Somebody has seen that, oh, my skin looks fabulous with isotretinoin. I should just go and buy it and keep continuing. It can increase your cholesterol levels. Okay.
Okay.
And that is why it's a drug which has to be monitored. So people think, oh my God, it's not a
Hmm.
good drug, and it's this, it has a lot of side effects, it's this, that. No, it has to be taken the right way, the right dosage, the right way for the right amount of time. Do not self medicate. Do not start taking it on your own. Do not play with the dosage on your own. And if for a female who is planning to conceive, stop it at least 3 to 4 months before you plan your pregnancy.
So does this also apply to the to her partner, to her male
No, it
partner?
doesn't apply to the partner. Doesn't apply
Okay.
to the partner. Yeah.
Uh, Dr. Sharad, thank you so much. We had some time limitation today, but we covered a lot of things. And with your presence, I think I would really look forward to having you again on the show, because I was having a lot of fun, because it was kind of a personal experience for me as well, because I am also going through that acne issues. And I mean, like me, there are a lot of youngsters, there are a lot of people who are going through this acne issues, and I'm pretty sure that they would be looking forward to this episode. So thank you, ma'am. Thank you again.
My
And
pleasure.
I look forward to hosting you again. And it was wonderful speaking to you.
Thank
And
you. You are a great host. I mean,
thank you so
really,
much.
I've done lots of podcasts, but you're really amazing. Thank you so much for having me.
Thank you so much, ma'am. That really motivates us. Thank you so
Thank you.
much.